For joining us this evening. The Minister of Basic Education, Angie Motshekga, will release the 2014 Matric results. Now, this period also brings along with it some anxiety, as thousands of learners will receive their results tomorrow morning, and some will not be pleased with what they see. They'll be finding out what they can do to lower the risk of mental health issues this morning, and how also their loved ones can support them. So we're joined by Lorena Corelli, who is the senior counsellor from the South African Depression and Anxiety Group. Very good morning to you. Thank you so much for joining us.
Good morning.
I started the show this morning with my colleague Sam by saying that although this time of year is an important rite of passage, I suppose you can call it a coming of age ceremony academically, it's quite important. I think it's crucial for the life of any human being once they get to Matric. But in the greater scheme of things, it's not a matter of life and death. And yet you find so many youngsters thinking that it's the be-all and end-all if they don't do so well, and perhaps that can affect them mentally and their mental health. Do you find that that's an issue that we face as a country?
Right, well, we can't really say, with the increase of suicides that during the festivities or during the release of the Matric results that it's going to increase. Suicide in particular happens right through the year. So we can't say for sure that that's going to be, a big issue kind of thing. With regards to the Matrics, we are going to see the level of depression going up. Okay, reason being is some of the matriculants haven't done well. To those who have done well, congratulations for them. So you are going to see that level of, I let myself down. I've let my family down and I've let my friends down as well. So we are going to be probably inundated with calls with regards to what are we going to do, where do we proceed from now, and we are going to have to take it from there.
Do you see an increase in calls and the volume of calls that you receive this time of year?
Absolutely. Especially now that the Matric results are going to be released, there is going to be an increase. Like I said previously, where do we go from here? It's a complete letdown. I have let myself down, I've let my family down. The only option would be is to take myself out, is, the suicide. It's not an option. There are options available out there. Pick yourself up, try again, and see where it takes you.
Do you find that perhaps the results are just the straw that broke the camel's back? Many times that's not just the issue, that perhaps it's just one of a number of reasons why someone would be feeling depressed, or do you think it's an isolated thing and it's just the results?
We must remember that depression doesn't just happen. It is a build-up of many things. Now, obviously, the matriculants right through the year, they've had an enormous amount of pressure, conforming to certain standards. Perhaps there was circumstances within. Have a look at circumstances within different communities. Sometimes they weren't able to study due to violence, due to substance abuse, etc., etc. And all of that leads to a massive build-up of depression. So we can't say, no, depression just happens with a click of a finger. No.
I want to further explore this issue, just taking a look at the chemical imbalances, perhaps medication, perhaps the counseling, and how you deal with the issue in various communities as well. So I do know that you have agreed to stay a little bit longer with us, because we are going to have to take a break at some stage and take our 7 o'clock news thereafter, at least, maybe for about 5 minutes or so, if you could stay with us, because we have run out of time, but I do have a number of things to speak to you about. So